It's an honor for me to be here tonight, and thank you, Dr. Carl, for that generous introduction, and the audience for spending your evening with us. While I survived this relentless disease myself, I lived to see many people that I care about, family members, classmates, friends, and many of my patients prematurely pass because of cancer. From a grandfather who died with osteosarcoma to friends who died of acute leukemia and breast cancer, and a classmate who was a genius medical student who died of brain tumor at a very early age, and now my patients. And early on in my career, when I was researching cancer and cancer cells, I realized that the cure of cancer is not really by adding more drugs, and that there is a need for innovative approaches to be able to prolong the survival or even cure this disease. And I'm going to tell you why it's not with drugs or adding more drugs that we cure cancer. So traditionally speaking, we used to treat, or we still are sometimes treating cancer with, if it is limited, with surgery and radiation therapy. And then if it is disseminated or metastasized, we treat it with chemotherapy. And all of those, they come with limitations and peculiar adverse events to each of them. And most recently, we also started identifying cancer markers or biomarkers that are expressed by cancer cells, and we tried to target those. And there are many, many of those, from targeting, from targeting the tumor DNA and the mutation, to the way that it uses other tissues, autophagy, to feed itself, to how it proliferates, and all of these other mechanisms that we use to target tumor cells. But what we saw is that most of these methodologies, including the traditional and the most new, is that all of those, they pour into drug resistance, and that's why the tumors come back. And again, I'm going to show you why that is. It's because of what we call tumor heterogeneity. So if we take a tumor that is getting established or growing, it's composed of millions of cells, and although the majority of these cells are very similar, there are minor differences between them that makes them susceptible or resistant to one medication versus another. So as we treat these tumors, we realize that some of these cells, with the minor differences that they have, they respond to the modality of treatment that we use. But then we either can add, some of them are resistant, and some resistance we create by using those medications that I went over. And we end up with the tumor either not going away or coming back and goes away for a short period of time. Because of this, again, we try all the time to come up with more innovative ways of treating this tumor. And tonight here, I'm going to talk to you about immunotherapy, how it works, and what's the outcome, and how did it affect patients' outcome and everything. So we look at this here, a T cell. It's a representative of the immune system. And this T cell have coexisted for a long time with normal cells, because this normal cell carry a red signal on its surface that tells the immune cell, don't eat me. I am your friend. I'm from this body. Don't come near me. When cells are changed by either an infection or even a trauma, inflammation, or by cancer, because of the mutations and the genetic changes that happen in there, these cells, they have initially a signal that is a green light, and it gives the T cell a green light to eat it or kill it. And that's the mechanism by which the immune system kills cancer cells, and kill any other cell that is not useful to the body as of that time. And those two, the red and the green signals, they are called immune checkpoints. And because cancer cells are very clever, they always try to evade the immune system that we have. And the way they do this is by increasing their mutations and changing their morphology to try to trick this T cell that I am familiar. I am like the normal cells. And that will lead to the exhaustion of the T cell because it keeps trying to kill those cells, but then now the cell is more close to the normal cells, and that doesn't happen. And so scientists over the year thought about blocking these red signals and make this mechanism whereby the tumor cell tolerizes the T cells to it not valid any longer. And two of the most famous scientists in this are James Allison and Tasuku Honjo, who in 1990s discovered something called checkpoints inhibitors to try to stop this resistance mechanism. And those drugs that would stop this are immune therapy. They are monoclonal antibodies that will block that interaction between the T cell and the tumor cell, making it more amenable to be killed by the immune system. And for that, the FDA approved this modality of treatment, and we have many of those now approved by the FDA. And the two scientists, they won the Nobel Prize for this very big discovery in cancer treatment. And then the other mechanism, which is, like I said, one is a green light and one is a red light. Now, the green light is, we can enhance that. We can make the T cell more resistant to this trickery that the cancer is trying to impose on it. And one way of doing this is by enhancing those T cells. And the way we enhance the T cells is by introducing a genetic material into it called chimeric antigen receptor piece of DNA that will we introduce through a disabled virus into the T cell. And this piece of genetic material will go to the DNA of the T cells, and then it will be expressed as monoclonal antibodies, similar to the ones that the other two scientists created for checkpoints. And this T cell will become much more equipped and empowered to go ahead and fight cancer again, enhancing that green signal that we spoke about, and then attaches itself to cancer cells and boom, kill it. So that's the way this particular modality treat cancers. There are now many, many, many ways that we can enhance and empower the immune system to do this job by making it stronger to attack cancer cells. One of them is the CAR T cells I spoke about. One of them is similar to the CAR T cells called fusion proteins, and of course the monoclonal antibody, which is one of the older modalities in immune therapy. And then we have tumor vaccines, whereby we take some cells and expose them to the tumor antigens or proteins and then make them more empowered. And then we have oncolytic viruses that we can use, cytokines to stimulate the immune system, and natural killers is part of, like the T cell, it's another part of the immune system. We can take them out, expand them, make them stronger, and put them back in the patient, and so on and so forth. And this field is very active right now in research, in production of treatments and drugs all over the world, and mainly here in the United States. They do have side effects, and the major side effect, unlike chemotherapy, where they, for example, suppress the immune system, they cause organ dysfunction, they cause hair loss, they cause resistance, and all of these things that I spoke about. The major side effect of CAR T cells or immune therapy is overactivation of the immune system. It's in science called cytokine release syndrome, if you guys have heard of that anytime. So because these T cells go into the body and they are very strong, they produce a protein or proteins called cytokines that they fuel themselves by. And at that point, they are so powerful that they might also attack the normal cells together with the cancer cells, but by no means as much as they attack cancer cells. And that is one of the major side effects that we're trying to modify and adjust and make it less without affecting their efficacy towards killing tumors. What may be the future of this field? Lots of things are happening, such as evaluating of these modalities early in disease, because in research, first we use them in advanced disease status, any medication, including immune therapy, and then take them into the upfront. Although some of the diseases, they have them upfront now, but not all of them. So that field is open for research. Optimizing biomarkers and changing their schedule. Biomarkers meaning finding more targets that the T cell can attack, and then playing around with their schedule to decrease the side effects while keeping them effective. identifying new targets, evaluating them in combination with chemotherapy in cases of more aggressive tumors that we don't expect the immune system, even with the empowerment of immunotherapy, to be able to fight cancers, and then evaluating them across cancer types, because for now it's only in a handful type of cancers that we use immunotherapies. And a few years ago, I did not think that using the immune system and empowering it to this extent is possible. But now, with the promise of immunotherapy, I know that we are on the right path. And thank you very much for listening to me.